Hi, my name is Nicole, and the topic I have chosen is substance abuse in nursing. So for nurses, the long hours, overtime, short staffing, and working shift work, having the knowledge and the accessibility to narcotics plays a major factor in developing addiction. Nurses with untreated addiction can jeopardize the patient's safety with impaired judgment, slower reactions, diverting drugs, medication errors, or dosage errors. Being nursing students, we need to understand and remember that addiction is a disease, just the same as any other disease. It can affect the individual in all aspects of their work, family, and personal relationships. When finishing nursing school and becoming a licensed practical nurse, we know that we must follow the Code of Ethics by our governing body, which is Saskatchewan Association of Practical Nurses, also known as SELPN. As we have learned in personal and professional relationships, there's many sections of our Code of Ethics that need to be followed. So let's just review let's review the codes. Responsibility to the public, responsibility to the client, responsibility to the profession, responsibility to the colleagues, and responsibility to oneself. The next aspect of substance abuse is trust. As students, our instructors need to trust our knowledge and skills that they have taught us is exactly what we need to know, and that we'll be comfortable to do it in the workplace. As nursing students, we need to develop the trusting relationship with patients and their families. We never want to jeopardize that level of trust. We need to remember to maintain a personal professional relationship. Working though, we don't. While working in a healthcare field, we need to be aware of the signs and symptoms that someone we are working with is under the influence. Things to watch out for and note are the following: behavioral changes, absences from the unit and patients for extended periods, multiple trips to the washroom, arriving late or arriving extremely early to work, making mistakes, altered gait, inappropriate responses, having confusion. Other things that might be happening in the workplace are included incorrect narcotic counts, large amounts of wastage or incorrect wastage, frequent reports of ineffective pain for their patients, or if they're looking after another nurse's patients, they could be offering medication to them as well for pain. Alterating verbal or phone orders from a physician. Of all these things, they may seem small over time, but as they add up and they're all put together, you can tell that there's actually an issue. When working with a nurse who is struggling with addiction, it is key to provide confidentiality, especially with trying to end the stigma around addiction. The individual who has a substance abuse issue needs support in place to be able to start the recovery process. This can either come from the workplace, friends, or family. The major aspect that I want to hit home in my presentation is when you watch a nurse draw up a narcotic, we know that it's a double sign. We know that it's a high alert medication, so we need to follow the 10 rights of medication and also do our 3 checks of medication administration. And we also need to remember to follow the employer's policy and procedures. When we're doing their narcotic counts, they need to be done properly, and both individuals need to assure that everything is accounted for. When wasting medications, this needs to also be done properly according to your agency's policy and procedures. Sadly, substance abuse in nursing is a very common issue. The fact that nurses have the education and the knowledge on the effects of the drugs, along with the fact that it is so easily accessible to them, plays a major role in their addiction. When I looked on SELPN's website and looked under the topic of disciplinary decisions, from the first case in 2009 to present, I would have to say that over those half of those disciplinary decisions were related to substance abuse, missing narcotics, or not properly charting narcotic administration. I have included a video in my presentation I watched many videos and they all very much have similar stories. This video is about Emily. She tells her story. She was a labor and delivery nurse. She went to rehab twice for her addiction. The first time she only went because her husband was pleading her to go. She wasn't ready to get sober, so she had a relapse the very same day she got out of treatment. It was very aggressively escalated from there. By July 2012, she was taking deathly doses 9 times a day, and that's when it finally hit her that she needed to become clean for her family. So here's her story. We're just gonna watch the YouTube video.
I had an amazing childhood. I had a loving mother, a loving father, 2 wonderful sisters. I don't know how I ended up being that way. I started from a young age noticing that my tolerance for drugs and alcohol were much different from my friends. I experimented with alcohol and marijuana as a teenager and noticed that there was never enough. I started with pills, pain prescription that escalated very quickly. As a nurse, I found out that I had the access I needed to continue supporting my addiction. In the beginning, I was able to use pills. Once it was out, I was okay. Didn't have any withdrawal symptoms. But once I started using morphine and Dilaudid, it went from getting high and it being fun to needing it every day, all day. It progressed so quickly, the disease of addiction just took over my life. My lowest point was when I was escorted out of the hospital. I had been caught for diversion of narcotics. It was my rock bottom. I worked so hard to become a nurse. This was the last thing I could ever imagine myself doing. It broke my heart. I was lost. I identify myself as a nurse. I lost my license to practice nursing. There's no words. I was devastated. When I first got to First Step, I missed my family tremendously. My little girls, my husband, but I knew I needed to be there. I knew it was the right thing to do. I could be away from them for just a little bit of time and focus on me and get better, or I could die. My addiction had got to the point I could be one use away from dying and not be able to be there and watch them grow up. The counselors at First Step were amazing. I worked very hard over several years. I got my nursing license back. I'm finally able to be the wife and mother I was always meant to be. And I actually got a job back in the same area of nursing that I love. You have to put it first. Your sobriety has to be first. You reach out to other people struggling, you speak with your sponsor, you go to meetings, you do what you need to do because this life is worth it.